Hello, class. My name is Christelle Chimi. I am a student at Hus University and I'm enrolled in a psychiatric health mental nurse practitioner program. Today, my presentation will be focused on a substance that is prevalently being abused in our society. And the substance of choice that I use for my presentation is opioid. I'll start with the introduction. Opioid is a class of powerful pain relieving drugs. When they are misused, they can lead to addiction, overdose, and sometimes death. The present so and also they can be also so the consequences of opioid addiction can be severe, not only for the individual but also for the loved ones. So also we have treatment options available for opioid abuse, such as medication, assisted therapy, and behavioral therapy to help individuals overcome their addiction. It's also crucial to raise awareness about the dangers of opioid abuse, and also we have to promote effective prevention and treatment strategies to fight against the ongoing substance abuse. Let's talk about the history of abuse. The use of opioids for medical purpose dates back centuries, but the addictive nature has been recognized for a long time. The widespread use of opioids like morphine, followed by the introduction of synthetic opioid and issues with drug regulation, has led to a significant public health crisis of opioid abuse. Factors such as overprescription, aggressive marketing, and a lack of education have contributed to the devastating consequences of the long history of abuse, impacting the lives of millions and causing a resurgence in the opioid epidemic. The prevalence and epidemiology in the US of the opioid. Opioid misuse is widespread in the United States. We have millions of Americans are affected by opioid misuse. So in 2019, we have 10 million people misuse of prescription of opioid. So also, the National Institute of Drug Abuse, NIDA, reported that over 50,000 people die from opioid overdose. So certain population may be at a higher risk for opioid abuse. Neither considers opioid abuse to be a serious problem. What are next will be the risk factors risk factors and vulnerable population. So so we have to talk about the risk factors and the vulnerable population. Chronic pain, substance abuse history, mental health disorder, and age are risk factors that can make specific population more vulnerable to opioid addiction. Individuals with chronic pain who are prescribed opioid for pain management are at higher risk of developing an addiction. Having a history of substance abuse with other drugs also increases the likelihood of misusing opioid. Mental health disorders such as depression or anxiety can further heighten the risk of opioid abuse. In addition, young adults between the age of 18 and 25 are more susceptible to misuse opioid than other age groups. Understanding these risk factors and vulnerable population is crucial in addressing the opioid epidemic and implementing effective prevention and intervention efforts. Next on the slide, we talk about short-term and long-term side effects of opioid. The short term of side effect of opioid is drowsiness, constipation, nausea, respiration, depression. In the long term, we have organ damage such as liver and heart, impaired cognitive function, dependence, addiction, and overdose. We have a sign and symptom here for opioid abuse. Sign and symptom we have the physical signs of opioid addiction, that we have loss of coordination. We have shallow or slow breathing rate. So your breathing can go as slow as 6 or 10. So we always have to monitor the respiration rate before we give the medication to a patient. We have intense nausea, constipation. So patient with opioids, we usually have to give also some laxative or some bowel movement medication to help them also go to the bowel, move the bowel while they're taking medication for either pain or anything. We also have slurred speech, drowsiness. We usually do not recommend to give opioid medication to a patient who is already sleepy, except maybe if the patient is, we use it for comfort care or hospice care, but we usually like to have the patient awake while he's taking the opioid medicine. We also have shaking and sweating. So we have some of the physiological and behavioral signs of opioid. We have depression, drastic mood swings, anxiety attacks, lower motivation, irritability, poor decision making, change in sleeping patterns, and sometimes financial hardship, and also have less time with loved ones and family. So what are we talk about? The next slide will be to talk about the potential for overdose or use of suicide weapons. So opioid overdose is a top cause of accidental death in America. So we have some signs of overdose. We have slow breathing, pinpoint pupils, loss of consciousness. So, so opioid can also be used intentionally as a means of suicide. So that dual potential for harming self is crucial for individuals to carefully monitor their opioid use and seek help if they suspect an overdose. Additionally, education and awareness surrounding the dangers of opioid has both a cause of accidental death and method of suicide are crucial in preventing these tragic outcomes. Next, we have to talk about example of care plan for a patient who is abusively using opioid. We have pharmacological treatment and a non-pharmacological treatment. We're going to talk about the pharmacological treatment. So, medication commonly used to reverse opioid abuse is methadone and buprenorphine. So we also have MAT that refer to the use of medication to treat substance use disorder, specifically opioid addiction. Methadone helps by acting on the same receptors in the brain as opioid, but with a slower and less intense effect, reducing cravings and withdrawal symptoms. Buprenorphine works similarly, but has a weaker effect and lower risk of dependence compared to methadone. We also have a non-pharmacological treatment. So the individual therapy, we have CBT that can help patient that develop coping mechanism and manage triggers. We have a support group, so we have to connect with others who understand addiction, can be a valuable source of support. So we have to talk about the You have to continue with the care plan. We have to talk about the patient education. We have to educate the patient about the risk of opioid abuse and addiction. We have to talk about the dangers, the dangers of the abuse and addiction, as well as informing them about the benefit and risk of the medication-assisted therapy, medication-assisted treatment. Additionally, a relapse prevention plan is developed to help patients maintain their recovery. We have to give a referral. The referral may also be made so that the patient can receive specialized care for pain management or mental health support. So this holistic approach to care aims to ensure the patient is well informed and supported in their recovery and well-being journey. So we need to also talk about regular follow-up. The regular follow-up appointments are essential component of the care plan. They allow for monitoring progress and adjustment to treatment plan as needed to ensure the patient's overall health and wellness. It helps to prevent relapse and is also crucial to monitor progress. In conclusion, although there are many facets to the problem of opioid abuse, action can be taken to solve the problem. We have to reduce the number of people who become dependent, and that reduction can be achieved by educating the public about the risks associated with opioid and putting preventive measures in place. Also, we can make thorough treatment program accessible to those who are addicted, and eventually we can contribute to a decrease in abuse of opioid. We may strive toward a future where opioid misuse is drastically decreased and people's well-being is given priority by being proactive and raising awareness. In conclusion, opioid abuse is a complex public health issue. With proper education, prevention strategies, and comprehensive treatment, we can support individuals struggling with addiction and strive for a future where opioid misuse is significantly reduced. That's about it. Thank you.